Hi everyone, I'm Alex with American Cell Technology. It is my pleasure today to introduce you to one of our very own banked athletes at ACT. Their accolades could go on for days, but just to highlight a few, they are a two-time Olympic champion, the first ever American to win gold in judo, two-time MMA world champion, mother, author, and philanthropist. Ladies and gentlemen, it is with my pleasure to introduce Kayla Harrison.
Thank you.
We're here to visit Dr. Purita, who's a pioneer in the regenerative medicine space. Why are you here today? Can you tell us a little bit more about that?
I sure can. So I am actually having a mini lipo procedure done today. Dr. Purita is going to take about a tablespoon of my fat. These are like my youngest cells, and we're going to turn them into stems and put them back in me and make some magic. So from 1 tablespoon of fat, we're going to get potentially billions of cells, and I'm going to be storing them with you guys at American Cell Technology.
This is your first time you're getting your adipose taken, but you've actually already stored your stem cells with us previously with your bone marrow.
Yeah, so originally I started kind of on my stem cell journey. I hurt my neck. I had 5 herniated discs in my neck. I went to see the doctor at the end of my 2022 season for the PFL at the time. And they looked at my MRI and they were like, I don't know how you're lifting a cup of coffee, let alone throwing a jab. You're in trouble. You're in trouble. And I didn't want to have surgery, because I felt like if I had surgery, that was probably going to be an end of my MMA career. So I started researching stems. I found a place to go and we did a bone marrow. I don't even know what you call it. Harvesting. And we did probably like 100 injections from like the base of my neck all the way down to my hips, like all over my back. And when I tell you it changed my life, it changed my life. My neck, knock on wood, has not been injured since. I have full range of motion. I was having tingling probably for a year and a half. Like these 3 fingers were numb 24/7. I don't have that anymore, totally fine. And so after that, I became a really big believer in stems. From that point, I was like, okay, I want to be able to utilize this and help keep my body in fighting shape for as long as I can, but I don't want to go use somebody else's tissue. I don't believe in that. How can we do it for me so that it can be beneficial? And what I learned from you guys actually is that bone marrow is great, but fat is the youngest and probably the best cells to use. So I actually learned about Dr. Purita from American Cell Technology. I learned that you guys partner with doctors all over the country. So if I'm in Salt Lake and I get injured and I need some stems, you guys will probably have a doctor in Salt Lake and you'll be able to get me my stems. That was another big reason that I was very excited for this partnership.
So being someone with extremely high standards as yourself, why have you chosen to partner with American Cell Technology?
Well, first of all, American Cell Technology carries themselves to the same standard that I do. Your reputation is pristine, so is mine. I felt like it was going to be a really good fit. Then I started doing some research on you guys. You've been around for a while. You've been in this game, in this space, probably for longer than any of the other companies that I looked into, and it just felt like it was the right fit. And what I'm most excited about is kind of like a recovery protocol, pre-fight and post-fight protocol. So Dr. Purita is gonna do IV injections. I've already done it with my bone marrow, harvested cells, but now we're gonna be using the fat cells, which are younger.
And I heard about fat. I said, wait a minute, fat? Little did I know that it was a gold mine of stem cells. Cells, not doctors, heal patients. I think that sums it up all. No matter what you're doing, if I'm going to give a patient a medication or your internist is going to give you a medication, he's trying to manipulate your cells to do certain things. But why not take it from the get-go and put the cells in there where they need it? This is going to revolutionize and change medicine.
And you're very forward-thinking. What most excites you for the future in regenerative medicine therapy?
It's where we're moving to. And I think we're realizing that we have to basically use our own cells. I'm still not a big fan of using cells from other sources. I think our own cells, which we call autologous cells, are really where it's at.
I think there's a lot of misunderstandings of people reading literature on stem cells. And stem cells is a very vague word. And some people think they have to go out of the country for this, and they can't have this done in the US.
Many people say, hey doc, should I go out of the country because I can get these cells and they're much younger? There's no real reason to do that. We can pretty much do many of the things that they're trying to accomplish there overseas, but I think we can do it better. And there's a couple of reasons why. First of all, when you go overseas, they'll tell you, well, these cells are immune privileged. These cells are immune evasive. Your immune system's going to go after them and eventually zap them. Number two, there's nothing as good as your own cell. The problem that we have is we may not have the proper numbers. Now, when we can incorporate that with a cell expansion of your own cells, that's going to be something good. There's no reason to go out of the country at all. When you're using your own cells, your body's going to say, oh, come on in, welcome. You're using allogenic cells. It's always an immune reaction. It may not be something that's going to be big, but eventually those cells do get nailed by our immune system. You're not going to have a reaction to these cells because of the fact that they're your own. Okay, simple as that. When you have a bank, you have a tremendous number of cells that can be made, and that's where it's going to really be beneficial for you, because it's a numbers game like anything else. And that's one of the reasons why I want to work with American Cell Technology, because I know it's an entity that I can trust, and I would give it to myself or my family with no hesitation. But if I have someone I think I can help, then I'm going to say, okay, you have a couple of options. We're going to take your bone marrow, we're going to take some of your adipose, your fat tissue, but you can consider also taking a little bit extra fat tissue. We could send it down to a lab, and you sort of have an insurance policy, because we have your stem cells that we can basically put in a bank, and when they're needed, go ahead and reproduce these cells and give us large numbers of them. Most people would be a candidate, I think. There's no reason not to bank your cells.
This message is for anyone who is thinking about harvesting their stem cells or using their stem cells in any way, shape, or form. I can promise you, I don't go to places that I don't like, and I like these guys.